Hi everyone. Yeah, we have quite a few people who have joined in and more people are joining in. So I'll just start with a quick introduction. I'll introduce Dr. Smriti and we'll go right into the questions. So I'm Sneha. I'm the founder of Yoma. And as you know, Yoma, this is the first Insta Live session that we have done with experts. We've worked with experts in different ways. This is the first Insta Live that we've done so far. So Yoma is a knowledge hub for expecting new and experienced moms and parents in Nepal. And Yoma covers articles from experts. We have mom contributors who've written articles, and we have lists on where to get what. Nepalma kaka ke paउँछ भनेर, because a lot of times मान्छेहरुलाई थाहा हुँदैन. They know के सामान चाहिन्छ, तर they think in Nepalमा त पाउँदै पाउँदैन भन्छ. So we're actually trying to make it clear. These are the products that you need, and these are the places that तपाईले your products are पाउन सक्नुहुन्छ भन्छ. So Dr. Smriti, she's a pediatrician. She's an associate professor of pediatrics at KMC. She has 9 years of experience, and she was the first Nepali to be trained by the International Pediatric Association for the Child Health Emerging Leaders Program. And so as a ground, one of the themes we also mentioned vaccines, because Dr. Smriti has been trained in vaccinology. She's served as the chairperson of the Immunization Committee of the Nepal Pediatric Society. And she's also trained numerous pediatricians and health workers across Nepal to be immunization advocacy champions. So, and we have actually received a lot of questions in our inbox regarding vaccines, which we will soon get into. And she's also a mom of 2 amazing children herself. So, Dr. Smriti, we can go right into the questions. So the first question is regarding sleep needs of infants. So a 3-month baby cannot go to sleep during the day and is overtired by the evening. So is it okay if the baby doesn't sleep much during the day? And what are the sleep requirements? I think a lot of parents find it very difficult when infants, they don't sleep much during the day. So it would be great if you could elaborate on that.
Right, Sneha, thanks for having me, you and your team. It's great to be able to help, especially you've done a lot of good work, even during the pandemic, a lot of information more. So it's been great to collaborate with you guys. So addressing the question, usually for babies of 3-month-old, they have to sleep for at least 14 to 16 hours in a day. So like out of the 24 hours, they have to spend at least 14 hours sleeping. So if this baby is, the mom feels that the baby isn't sleeping well, actually she should sit down and count the number of hours. If it sums up to 14, even if like there's no nap in the daytime and at night the child is sleeping for at least like 14 hours and an extra hour during the day, that's fine. But at this age, usually there are about 2 to 3 naps during the daytime. So the best way to go forward, if the mom thinks that the baby isn't sleeping too well or adequate for the age, is to set a pattern, Routine really helps. And even if the baby is already 3 months old, it's never too late to set a set routine for the baby. So I'd recommend at least 2 to 3 naps during the daytime, and at night at least 10 hours. So she'll have to count and work it out, and set pattern would help. Yes, Neha. So that's it for 3 months age babies.
Okay. So yeah, we have a few questions related to vaccine. So one of them is the baby is now 22 months old, and she's so far been following the government schedule for vaccines. But she hasn't completed some of the vaccines like chickenpox, hepatitis, and others that she saw on our list. List on Yoma. We've consulted a few pediatricians and included the national immunization schedule. If you go to yomanepal.com, you will also have access to the vaccine list. So she has said that these vaccines have not been given to her 22-month-old. So is it okay to give those vaccines? So how would you suggest she give the vaccines, and what is the minimum gap period between the various vaccines?
Right. So different countries have different vaccine schedules. Like depending on how developed the country is, you receive so many number of antigens. Like compared to the US, ours, we have only 11 antigen, which is provided for free by the government. So it's called the National Immunization Program. So we have 11 antigens so far, but if you compare it with the US, they have 16. So, I mean, you would want to prevent your baby with all the possible vaccines that are available in the market. So just because the government isn't able to pay for it, if you are aware and you're willing to give it to your child, of course you would want to prevent it. So there's nothing like you should give it or you shouldn't. It's you have to give it if it's available and if you're you have access to it. So basically, the government does give vaccine up to 15 months of age in Nepal, but some of them are missed in the sense that even flu vaccine can be given at 6 months if you choose to. And there are these vaccines which are not as part of the national schedule is known as additional or optional vaccines, which means that they are available in Nepal, but they're not being paid for it. You know, you have to pay it out of your own pocket. So I would recommend that you give the ones which are like really important, and your child can be prevented with these infectious diseases, especially before the child starts school. For example, chicken pox, you have to give it before the child goes to school, because chickenpox itself is quite a horrid disease and it can cause a lot of problems and complications. So you want to prevent your child from, you know, pushing into complications. When we were kids, we didn't have chickenpox as a vaccine. So almost all of us, I think, who were born in the 80s, 90s have contracted the disease. But now you have the option of, you know, choosing to prevent your child from getting chickenpox. So chickenpox, hepatitis A, you have your vaccine against meningitis, so meningococcal vaccines. So all these are available in the market, a little expensive, but I think it's worth giving it. And even the flu vaccine. The pandemic now, I think, has made people more what do I say, proactive. They want to get vaccines now, you know, even if it's not directly COVID-19 vaccine, but I see a lot of moms asking for flu vaccine for the kids. So out of fear or out of more awareness or even advocacy that they see in the news these days, people have become more welcome to vaccines as a result of the pandemic, I feel. So please go ahead and vaccinate your children, even with the ones which are not there in the national program. And to address the question of the gap between two vaccines, there are a lot of vaccines which can be given in the same sitting. You don't necessarily have to, depends actually which vaccine, but you don't necessarily have to wait for a gap between the two vaccines. But ideally, if you were to take an example, the minimum gap is 4 weeks between the two different vaccines. So yes, so you can even directly message your questions in the chat right here if you have any questions related to the vaccine, or later on directly to Yoma or one of us. Right, Sneha?
Yeah, certainly. Yeah, so if any of you who have joined here, you have any questions, please feel free to add it under comments and we'll address it. These are all questions that we received in our Yoma's inbox, because we had asked our followers for the questions if they had any. So the next question is related to constipation in children. A 17-month-old baby is constipated, so she wants to know what can be done about it. What are certain prevention? What food would you recommend feeding the baby?
Constipation has been very, very common these days, especially because of you know, use of commercial baby products, as well as lack of breastfeeding. A lot of moms are opting for formula milk, which itself is a risk factor to develop constipation. So this particular question is for a 17-month-old. it's a difficult cycle to break, constipation. Once the child is constipated, it goes on for like weeks together until and unless you, do something about it. But another tricky part of constipation at this age is that there aren't many safe medications to be used for under 2 years old. So we usually recommend natural, remedies, home remedies. So one thing you can do is increase the fluid intake in the child, may it be milk, may it be other fluid. And another thing you can do is introduce more fibers, and fibers can be in the form of oats, natural fruit fibers. And if still the child continues to be constipated, then you will have to visit your primary doctor or a pediatrician and see if this child can be prescribed medication according to the weight.
Okay. Yeah. Thank you, Dr. Smriti. So, I mean, that kind of touched upon solids. We have another question which is related to solids. So, the question is, I introduced buffalo milk to the baby after completing the first year. What is the quantity of milk that is to be given per day for babies up to 2 years?
Right, so she's done a good thing in the sense that she's introduced animal milk only after 12 months. We find a lot of Nepali mothers, even in the cities, they start animal milk very early, like they can't breastfeed, they opt for animal milk. Cow or buffalo are the most popular ones. So I'd like to say that animal milk is totally contraindicated. You should not give it before the baby's first birthday. So after 12 months is okay, but it takes some time for the baby to adjust to animal milk, because it's for one, it is difficult to digest by the baby's the whole gastrointestinal system, and it has very heavy proteins, which is difficult to process. So but since this child is 12 months and she's chosen buffalo milk, should be fine, but depending on whether she's still breastfeeding. So I'd recommend that if she's still breastfeeding, to predominantly breastfeed, and buffalo milk should be just an option or extra milk to address the gap. So at this age of 12 months to 24 months, the milk required is actually about 16 to 24 ounces. That would amount to about 500 to 750 ml per day. So that doesn't necessarily mean that it's totally buffalo milk. If I don't know whether she's still breastfeeding, so if she's still breastfeeding, I'd recommend breastfeeding along with the buffalo milk amounting to about 500 to 750 ml per day. Otherwise, if it's totally buffalo milk also, it's fine. But we have this tendency to dilute the milk, especially animal milk. They kind of add water to it, make it a lower concentration, thinking that it's difficult to digest. It's not good to do all that. If you are giving buffalo milk, give it as it comes. Make sure that it's pasteurized, it's boiled, and it's safe for the baby. So the amount is about 500 to 750 total in 24 hours for that age group. Yeah.
Interrupt, Dr. Smriti. We actually got, so the person who asked the question, she just mentioned in the comments that she is still breastfeeding.
Oh, that's great. Yeah. So breastfeeding is very tricky, that you don't know how much milk you are giving the baby until and unless you're pumping it and giving it through other means, then you can quantify. Otherwise, it's difficult to know how much you're breastfeeding. I can read it in the comments that she's still breastfeeding. So one time buffalo milk is fine. So to know if the breast milk is enough for the baby, one thing you can do is keep a track of her weight gain. So if the baby is gaining adequate weight, in even like without other milk supplements, just with breast milk, then that's fine. That means that your milk is enough. And another way of assessing is that if your baby is passing at least 8 times urine in 24 hours, that means that your milk is adequate. So these are two things that you can kind of cross-check whether you're producing enough milk. So I'd suggest stick to breastfeeding still, and 1 or 2 times buffalo milk is fine. But if you feel that your breast milk is going down in quantity, you can see if the weight gain and your urine output is fine for 24 hours. Yes, Neha.
Yeah. So there was another question that we had in this live session. So I thought we could also alternate between some of the questions that we have received.
Sure.
The question is, can we give brown sugar syrup to children under 1 for constipated baby? So I guess because we were talking about constipation and solids.
Yes. You know, like we have compared to Western world, here in Nepal, we introduced salt and added sugar very early to the baby's diet. Actually, the recommendation is even by the American Academy of Pediatrics and by WHO, you should not introduce salt. You should not add any sugar to the diet until the a child's first birthday. So brown sugar also is like refined sugar, but that doesn't really address your issue of constipation. So there are other methods. So we don't recommend brown sugar. And even Nepalko context, they use a lot of ghee. You know, constipation bhayo bachalai, and they start giving lot of added ghee, you know, not just in the daulo they're making or the rice they're giving, they add a lot of extra ghee, like directly feed the child with ghee. These are all superstitious belief, including brown sugar. So it doesn't really solve the problem. So no, please don't do that. Fibers and increased fluid is the way to go. And fibers, there are a lot of options even in the market, like even in commercially available, you know, oats, and you get fiber-rich biscuits specifically for babies in supermarkets. So you can try those before you go into other options like sugar and juices.
Mm-hmm. Yeah. Okay, thank you. So actually, we have a follow-up question that we probably missed from the earlier on the one who asked about providing buffalo milk for the baby. She's concerned that weight gain is not happening, so she's confused whether or not breast milk is enough and what to add. But I think you addressed that, right? That buffalo milk is the right thing.
Yes, so she's saying the P count is above 8, so which means the fluid that the baby is getting is fine. And weight gain, don't go by what the weight is, you know, say like 2 months or 3 months before. Why don't we check it tomorrow and then we check it after 2 weeks? So that way you can make sure that in the last 2 weeks the child, whether the baby is gaining adequate weight. So don't go by weight in the past. Take it tomorrow and after 2 weeks. That way you know the weight of the right now. Whether your milk, the secretion of the milk right now is adequate or not. So let's do that. And if you still feel the weight, it's different weight gain according to a mother and the weight gain, normal weight gain for a child for that age. No matter how much chubby the child is, the mother always feels that the child is less in weight, eating less. So better to consult a doctor and find out whether the weight is adequate. For that age, 15 grams per day is normal weight gain. So otherwise you can just check the weight tomorrow and after 2 weeks and let us know, and we can help you with to find out whether it's adequate or inadequate, and accordingly we can modify the milk quantity.
Mm-hmm. Yeah. So we have another question here regarding vaccines. Can we give Japanese encephalitis vaccine and Menaptra vaccine on the same day?
We usually don't do that. We give it once the child is 12 months completed, and then we call in the baby again for Menaptra dose. Menaptra, we usually give it after 2 years of age. So what you can do is, JE is part of the national schedule, so you can give it after 12 months complete, and then bring the child back again when the child is 2 years old for Menaptra. We don't give it on the same sitting.
Okay, so we'll alternate a few questions because we're receiving a lot of questions on this live chat, but we also already have some questions that a lot of followers sent us before. So we'll alternate between the live questions and the questions we already had. I hope that's fine for some of the viewers because we're waiting on. The question is atopic dermatitis on a 1-year-old baby curable? If yes, how? And do we need to use medicine for them?
Yeah, so first of all, I would want to know whether the atopic dermatitis was diagnosed by a pediatrician or a dermatologist, or it's just based on Google. So we have to make sure that the child does really have atopy. And atopic dermatitis is quite common in babies, and if it's really the diagnosis from a dermatologist or pediatrician, we need to treat it, and it's easily curable with the right medicine. But if you've diagnosed it on your own based on pictures and you're giving over-the-counter medicine, then it's difficult to heal or solve the problem. So I'd recommend that you visit a dermatologist or a pediatrician. If the right medicine, it's most of the babies are fine by the time they're 2.5 years old.
Okay. Thank you. So another question we have is related to solids. When can we start oats for the baby? And are the oats that are available in the market for adults, is that okay for us to give to the baby?
Oats can be started as early as 6 months of age. Like when you start off weaning, oats can be one of the options. But oats cannot be the first food that you give to your baby. You know, start with natural products, in the sense like start with some fruit puree like apple puree, or start with a single cereal. It can be in the form of rice. And it can even be commercially available. I won't name products, but there are a lot of products in the market which are ready-made. You just have to mix it with lukewarm water and it's ready to feed. So you can start with single cereal, or you can start with any puree, fruits or veggies. Once the child is adjusted to these things and gradually increase the amount, in about 2 weeks time you can start the oats, even if the baby is 6 months old. And yes, we don't have specifically targeted to babies the oats, but even adult oats are fine. But you have to make sure that you see the preparation. Some are roasted, which doesn't really need much cooking and can be directly fed, but raw oats you have to cook thoroughly before you give it to the baby. And whenever you start a new food, you should keep a gap of at least 3 days before you introduce another new food, so that you know whether your child is able to digest that particular food. Like, for example, you start oats today and mango tomorrow, and the child ends up with diarrhea. You don't know whether it's because of the mango or because of the oats. So keep a gap of 3 days. That way, you will know whether your baby is allergic to that particular food. Right, Sneha?
Yeah, definitely. So it's easier to rule out which food is causing that allergy, right? Yeah.
Right.
So yeah, lots of questions on babies' food. I guess moms are very much worried about how they eat.
That's our number one priority. Yes.
Sure.
Especially for new moms, it's they're not sure whether they're doing the right thing, because you know, in our society, in a joint family, there are a lot of people who give you free advice, and a lot of pressure from your older relatives, and surrounding around food. In Nepali culture, we have a lot of superstition and lot of do's and don'ts. We have things like, you know, chiso khana, tato khana, all that. So it makes any new mom, including me, being a pediatrician, I went through a lot of confusion of, you know, whether I was doing the right thing. So yeah, it's difficult. So platforms like Yoma really helps. You know, you can cross-check whether you're doing the right thing, and there's a lot of other moms also having the same conversation. So it's good to know what others are doing and whether you're doing the right thing or not.
Yeah, definitely. Yeah, it's at the top of my mind also, being a mom of 2 girls.
Yes.
And I mean, it's also phases for them, but sometimes we kind of worry too much. Like, aligati khana bhanna bittikai, you know, you get so worried, but it's important to remember that it's also a phase, and that, you know, it won't continue for some time. So our question that we received earlier, so it's about food chart again. So a food chart for 14 to 15-month-old baby up to 2 years and beyond. So basically, 14, basically food chart for kids. So it would be great if you could mention a few food groups, and also a food chart. It might be more difficult. So if there are particular resources that we can go to, and actually, Yoma we will be. This article is coming up also on food charts, and we've because online there are lots of information, international websites, food charts. But it's more like Nepali moms ko lagi, including Nepali food. We've made a chart like Nepali wo and those things integrated.
Yeah.
So yeah, it would be great if you could also mention that, and we will eventually share um, the link to the article as well.
To start with, food chart is a myth. In the sense, you don't have to stick to any food chart. It's like just try everything out and make sure. I mean, it's great that you have something to look at and follow, and like maybe for inspiration you're like always feeding a particular food and you want to change it. That's fine, you see a food chart, but you don't have to like stick to a food chart for babies like you do maybe for a disease like diabetes or somebody who has high uric acid. No. So just experiment and have fun with the food that you give to your baby, and don't stick to a particular chart which is so rigid. So mix and match, I would say, like you would do with your clothes. I mean, you don't wear the same t-shirt with the same pant every time. Maybe there are some people who do that, but you change your t-shirt with that particular pant, or you wear the same t-shirt and different pant. So it's the same with food. The only thing you have to keep in mind is that the portions. So in 24 hours, irrespective of whatever the age of the child is, so you've particularly asked for a 12-month-old to a 24-month-old, but you have to make sure that the child is getting adequate carbohydrate. Okay, so if you don't know what food contains carbs, then that's fine, go and see in the food chart, or it's so easy, just Google, according to the amount they specifically give you the carbs. So make sure that your baby is getting adequate carbs, adequate protein. Along with that, what you have to make sure is that your baby gets colored food. Colored in the sense naturally colored food. You have your colored vegetables, you have your colored fruits. So carrot, for instance, green vegetables, anything like beans, or even ripe pumpkin, yellow pumpkin. So all these have lot of color. So whenever you see colored food, those are the ones which have lot of vitamins and minerals. So in a day, if you give carbs in the form that you can opt for anything. You don't, just being a Nepali, you don't have to stick to rice. So carbs, along with protein, a good source is egg. So you can introduce egg to a baby as early as 6 to 8 months. So protein, egg is a very good source. Other source of protein can be meat products, but for those who don't, they opt to be vegetarian, then you can give your child soya bean or lot of pulses. But I just want to tell you that one piece of meat the protein which you get from one piece of meat could be 2 cups of dal pulses. So a baby can't have that much amount of dal. So egg and meat products, we recommend even for vegetarians, but it's necessary for the child's growth. And as I said, it's slow amount can give you a lot of protein. So it's in the child's context, it's very difficult sometimes to meet that requirement with veggie substitutes if you don't give meat products. So basically, in summary, make sure the baby gets colored veggies and fruits along with carbs and protein. So if you follow this rule, of course, these are semi-solids. These are things which you are giving along with milk. So these are extra top. Just because you have started semi-solid doesn't mean that you stop the milk that you are giving, and don't decrease the amount of milk. Continue the milk. Along with that, make sure the child gets these portions of nutrients. So food chart, good to follow. Don't stick to it. Just mix and match and experiment and have fun feeding your child. I mean, don't think of it as something so rigid that you have to stick to something, I'd say.
Yeah. Yeah. Eating the rainbow ones. I mean, eat all color
Right, yes.
Yeah. Okay, so we have another question. Yeah, comments. My normally 15-month measles ko vaccine launda fever now na parni, but my baby had fever. And 12-month ko vaccine dilo dinu paryo due to her common cold. So she kept a gap of 2 months for 2 vaccines.
Yeah, she's right. So MR, MMR, they don't usually cause fever, but it's not that this vaccine is not known at all to cause fever. So fever may be a rare side effect of the vaccine. So it does happen, you know. For every vaccine, there are common side effects, rare side effects, and severe side effects. So some babies do manifest with fever, even with MR. So that's perfectly fine. And delaying a dose of any vaccine is not recommended, but even if you do, as long as you give that particular vaccine to the child, that's fine. Postpone it, but don't cancel it.
Yeah. Okay, thank you. So yeah, we have lots of questions coming in, so I'm going into the questions.
Sure.
Ani, so is by when should a baby sit without support?
Again, with developmental milestones, every baby is different. You know, like some babies start walking as early as 9 months. Some baby go on till 15, 16 months without walking. So every baby has their own pace of development. They're individuals. So we have a range for what normal is. So sitting usually happens by the time, without support, happens by the time the child is 6 or 7 months. But even if your baby is slightly, you know, too early or too late, that's normal. So you don't have to really fret about it. But if the baby doesn't sit even till the baby is 12 months old, then that's a problem. Normal range, deviating a little here and there is fine. So all these when you take the child for your vaccine or a well baby clinic, they have an overall look at the baby and see if your baby is on track. So that's more than enough. So don't sit and worry about, you know, oh, my friend's child is already sitting without support, my baby isn't. So don't compare. I mean, most babies are 99% of the time they're fine. I mean, little delay here and there is perfectly fine. When you're worried, go to your pediatrician and they will keep your mind at rest. Mothers tend to worry a lot, so just make sure that your child is on track. And every vaccine visit, they have an overall look at your child, and you will know that whether the baby is developing according to the expected age.
Okay, thank you. So our quiz, I'm adding chia seeds to mashed apples. And she just started weaning her baby this week only. She wants to know if that's okay or not. Adding chia seeds with apples as early.
Yes. So chia is, what do I say? It's going by the food fashion, I'd say. People are into chia seeds. So there's nothing wrong in adding it, I'd say. But I don't know whether it's safe for a baby as small as 6 months. So you have to think of it with a pinch of salt. So why experiment at such a early age? Chia seed is good for bigger children who have constipation issues, and chia seed usually is recommended after 2 years of age if you look at the literature. So 6 months is early, but you never know, you know, it's a new food. So later on you might read in articles that it's safe even for a 6-month-old, but I feel that we're at a very early stage to say whether it's safe. And 6 months, I personally feel, is a bit too early, and she doesn't need it, you know. Just apple puree should be fine. I mean, just adding few chia seeds won't really give her any benefits, but hopefully no side effects either.
Yeah, thank you. Yeah. So we'll go back to a question we received in the messages. So for a 6-year-old boy, should I give any vitamin supplement or calcium tablet? Should I give omega-3 fish oil tablet or multivitamin? And it would be great if you could also mention when you suggest introducing multivitamins. Like?
Okay, so multivitamins, irrespective of whatever the age of the child, if the child is having a balanced diet, meaning that the child is getting adequate minerals and vitamins from food itself, then it's not necessary. For example, in a newborn who is born early, like we call them preterm babies, before the normal date of delivery, so those preterm babies need multivitamins. So there are certain recommendations, and some babies who have had a long chronic illness, for example, let's say somebody who's just had a bout of pneumonia, was admitted for a prolonged period, 7 to 10 days of IV antibiotic, we would send him home to recover with multivitamins. Someone who has malnutrition, so like there are it's like even multivitamin is like a medicine, it's a drug. You don't give paracetamol I mean, when you don't have fever or pain, right? It's the same thing with multivitamins. You don't necessarily have to give. But even if you do, like during the pandemic, COVID-19, everybody was giving multivitamins right, left, and center. But even if you did, that's fine. There's no side effects because most of the multivitamin, they don't cause any harm to the body. It just if it's extra, it gets excreted in the urine. So you will notice when you have multivitamins, you have high colored urine. But really, we don't give it until and unless it's indicated. And same thing with calcium. If the baby has adequate dairy, in the same milk, cheese, all the dairy products in the food, he doesn't need extra calcium. And just because you give calcium doesn't mean that your child is going to grow overnight and shoot up in height. No, these are all superstitions. If we believe there's a deficiency, we do a blood test, we see whether the calcium levels are low in the body, then only prescribe calcium. So multivitamin, calcium, these are all drugs. But you notice that if you go to the pharmacy, they would happily give you one. So it's up to you whether you want to give your child extra just for the sake of it. But I'm sure if the child is having a balanced diet, it's not required at all.
Right. Yeah, thank you, Dr. Smriti. So we have also a question here in our comments, which is also very much linked. My baby is a premature baby of 1.2 kg. He had a history of hydrocephalus and cerebral palsy. I believe I have been giving him nutrition, but his weight at the age of 3, so he's 3 years now, is around 8.7 kgs. Is this a good weight? What would you suggest?
For that, I would need, you said 1.2 kg birth weight, right?
Birth weight, yeah, premature baby of 1.2 kg.
Okay,
so and cerebral palsy.
So this baby has a lot of issues, in the sense like the baby was born preterm and probably had problems during birth or immediately after, which has caused some form of brain damage leading to cerebral palsy, or the hydrocephalus itself could also be the cause. So we can't comment on that just based on the birth weight and the present weight. To know whether your child is on track in the growth chart, we need to plot from birth till like now when he's 3 years old and see if he's following the centile that is expected. So we can't say whether 8.2 for him right now is adequate weight or not. So I'm sure you are taking the child for follow-up to, your primary pediatrician. So next time you go, you can ask to see where, and like you can have a talk with the doctor to see if the growth and the weight gain is adequate and following the centiles. So you can do that.
Yeah. Thank you. So someone has asked, can you please elaborate about the anomaly scan? I guess she's referring to the anomaly scan that's done during pregnancy. Yeah.
Right. So I think it's, she's talking about the congenital anomaly scan. That is for any pregnant woman. We do a screening. Okay, so to tell you in simple terms, anomaly scan is to see if your baby has any defects. So that can be picked up with the ultrasound. So between 18 to 20 weeks, usually 20 weeks, the pregnant woman is subjected to an anomaly scan. The ultrasound, the radiologist will be able to pick up if there is any defects in the ultrasound itself. So there are certain things they look in an anomaly scan. For example, they will see if the lungs are all right and whether the baby has both the lungs. And even as simple as, if the nasal bone is missing, it points towards like certain diseases that you can predict, like maybe the baby is having Down syndrome. So things like that you can really see in the ultrasound in your anomaly scan. This means that if there's a major defect, for example, the baby's brain is replaced totally by fluid. Suppose you see that in your anomaly scan. So this baby is going to be born with a lot of problems, or maybe will not even survive till 9 months in the womb. So you can pick it up early and tell the mom that this is what's happening with the fetus, and you have an option of terminating the pregnancy. So basically in anomaly scan, we're trying to see if there's any major defect in the baby's major organs and the whole system, to know whether you should go ahead basically with the pregnancy, or if there are any problems in the baby. But minor things are also picked up. For example, there may be some heart diseases which are okay, like compatible with life, but you can know and anticipate when the baby is born that okay, this baby has this risk factor and we need to be careful and prepared to expect this. So things like that we can know by an anomaly scan. So that is done at 20 weeks, and other ultrasounds that you do before and after the anomaly scan isn't so detailed. All they see is like the weight gain and whether there is enough fluid in the pregnant woman's belly. So you have to have an anomaly scan. That too, let me say that from a very good radiologist, because it is a very subjective test depending on the skill of the radiologist. So make sure you do it in a good center with a good machine. So that's what an anomaly scan is.
Yeah. Okay. Thank you. So we have another question related to vaccines. So it's difficult to find additional vaccines easily in pharmacies. Can you suggest which hospitals we can get vaccines for a 14-month-old?
Oh, okay. So please don't buy vaccines in a pharmacy. Of course, they do keep some vaccines, but most of the vaccine available in the pharmacy, they do not maintain something known as cold chain. Cold chain is when, from the point of the manufacture of the vaccine till the baby receives, it has to maintain a certain temperature, low temperature. So it has to go through the transport, the storage in the pharmacy. All that has to be in a particular cold temperature. Let's say -4 for, just a hypothetical vaccine. So -4, if it's not maintained and the pharmacy has kept the vaccine out of the fridge or even frozen it in the deep freeze, so the vaccine is not viable, or even can cause a lot of complications. So go to a hospital, don't just buy it in a pharmacy. And any hospital, if you're based in Kathmandu, any hospital you can think of with a pediatrician will have a vaccine center. And most of the major medical colleges, like where I work, Kathmandu Medical College, the government programs are running where they run all the national immunization program vaccines are available in these colleges. So any center which is near to you will have the vaccine. So 14-month-old, I'm sure you've given till JE when the baby is 12 months complete. So next vaccine I would recommend is a part of the national program. You will have to give the MR second dose at 15 months of age. Then after that, you can go in for optional vaccine, additional vaccine. While we are at it, let me just address another issue. There's no regulation in Nepal to see if the centers, the hospitals, the clinics are charging more or less for the vaccine. The actual cost of the vaccine could be something like 1,200, and depending on where you go, that same vaccine could cost you 1,200, or it would cost you 12,000. So nobody monitors the price, you know. So do a bit of homework, and don't just blindly go and pay extra for the vaccine, I'd say.
Yeah. So we've receiving comments about when patients can come to you, when they can meet Dr. Smriti, which days and what timing, and where you're available.
Okay, I work in yeah, okay, so I work in Kathmandu Medical College. So I have my clinic, private clinic too there. So if you want to come and visit me in the private clinic, that would be every day between 2 to 4 p.m. But I work there from 9 to 5. So my general OPDs are on Sundays and Wednesdays. So Sundays, Wednesdays, general OPD 9 to 5. If you want to meet me in a clinic or in a private clinic, that would be same site, Kathmandu Medical College, but between 2 to 4 p.m.
Okay, thank you. So we'll go back to the question we received in our inbox. How do you calm a 7-year-old boy? Is there any particular things to train him? He's very hyper and seems like he doesn't understand his surroundings.
Okay, there are two separate things going on here. Calming a 7-year-old is different from someone who's like not really aware of the surroundings and is like, the mother feels that the child is too hyper. So let me just break it into two. So 7-year-old, for you to calm a 7-year-old, what you can do is, you know, in most of the households in Nepal, we don't talk about our feelings. We don't, bring it as part of our conversation, and we don't really talk about it. Like simple as, I am feeling happy. Most of the kids, I'm sure like they've never heard their mom or dad say that, you know. You just, you expect them to understand it by your expressions and like how you treat them, rather than from what you are saying verbally. So it's very important that from a young age, you need to teach the child how to talk about their feelings. You know, I am angry, I'm unhappy, I'm sad. The way to do that is to do it yourself. Kids mimic you, you know, they learn it from you. So you're the one who has to set the trend and expect them to do the same thing. So someone who doesn't really express or talk about their feelings will have a difficult time processing it, and maybe may appear very angry or difficult to calm down. So that's one thing. But with your child, since you are specifically saying that he is a bit detached from his surrounding, and I feel these are early signs of autistic behavior. So I would recommend, or maybe you've already visited someone who can tell you more about it. So we usually recommend a pediatrician who specializes in developmental we call them developmental pediatricians. So you can either go there or meet a clinical psychologist. They have a set of tests which they will subject to your 7-year-old, and will be able to tell you whether it's normal or deviating a bit from normal behavior, and he may need counseling sessions, or if it's extreme, may even need few drugs. So but why wait it out? You know, if you know that the child is behaving a bit different, go and take care of it. Yeah.
Yeah, thank you. So another question that we just received here: my child is constipated, and I've just introduced eggs and or meat. Is that okay for a 7-month-old baby?
Yeah, that's
He's
fine.
just introduced eggs and meat
Yeah.
for the baby.
So
That's
Yeah,
constipation.
that's fine. I think it's not like in adults where you eat too much meat and you get constipated. So in babies, you can, because they're not gonna have like a huge amount, so much so that the diet itself causes constipation. And egg doesn't really, I mean, meat yes, but egg doesn't really cause constipation. So please don't stop what you've introduced. Continue it in moderate amounts. It's not like you give meat in every meals. So break it out, give it in like 2-3 alternate days, or after every 2-3 meals. You can continue to give egg and meat even if your child is constipated.
Okay. So thank you. We have another question. 4-month-old baby is having gas problem and loose stool. I'm breastfeeding, so any food that she should avoid. So she's a breastfeeding mom of a 4-month-old baby who's having gas. Is there any particular food that she should avoid?
Okay, so is it my internet or Sneha, can you hear me?
Yeah, I can hear you.
Oh, okay. So the video froze just now, so I wasn't sure. Okay, so breastfed moms can eat everything and anything except maybe, I mean, it's like this. Like, let's say you eat a bit of spicy food, okay? So you expect the baby to have a bit of diarrhea and more frequent stools. Doesn't mean that you don't eat it. So you will have consequences if you eat those stuff. So if you don't want too many diaper changes, then stick to something which won't cause frequent stools or loose motion. So I'll just tell you some food which is known to cause frequent loose stools in babies who are exclusively breastfed. So if the mom has spicy food like chili and lot of added what do I say? You have those sauce, hot sauce. So that is one. Another known to cause diarrhea in babies who are breastfed is cabbage and cauliflower and green vegetables, sag, all that can cause, but it shouldn't prevent you from not eating those if you're ready with to deal with the increased stool in the baby. But this 4-month-old, since she's saying that there's increase in frequency, I'd recommend maybe you get a stool test done, and if the stool test is normal, your baby doesn't need any treatment. But if the stool has any infection or showing some indigestion, then the baby might need medication.
Okay. Yeah, thank you, Dr. Smriti. So we have 5 more minutes for the 1 hour session, but it's Insta Live.
Right.
So we have 4 questions that we have remaining. We'll answer those questions, and also for those who are live, if there are any other questions, please definitely send it to. You can message Yoma, and then we'll pass it to Dr. Smriti, and then we'll make sure that that your questions will get answered. But I'm just saying because we said it's an hour-long session, so we have 4 more questions, Saru. So I'm a working mom and I have to work 3 hours a day. My baby is 5 months old and only breastfeeds. So he doesn't drink from the bottle or from a spoon and is feeding on biscuits. Is that okay? 5-month-old baby.
5 months old. See, weaning semi-solid, including anything, be it biscuit, be anything else, it is ideally to be started only after your baby is 6 months. Okay, so 5 months biscuit, I would say, is early, but that's the recommendation by WHO and American Academy of Pediatrics. 6 months is the age you're supposed to start. But there are certain countries who don't follow it. In countries like Australia, they start weaning at 4 months. But I would say, even if you're a working mom and your baby is refusing the bottle and spoon feeding, don't give up. There's nothing as good as breast milk. So don't give up. Keep trying. For the baby to accept the bottle, sometimes it takes as long as 10 to 14 days, as long as 2 weeks. So keep trying, and you've even tried spoon feeding. So there's nothing as good as breast milk. Try to continue it as long as 2 years of age. And if you don't have an option, I don't think biscuit would be the right choice. Maybe you could add some cereal, a single grain-based cereal, like specifically only wheat or only rice, compared to just biscuit, if you really have to wean. And even fruit puree like apple, banana, mashed banana, avocado should work fine if you're but don't stop the breastfeeding. Try to continue it, and don't give up on the baby, like not based on just not taking the bottle. They do. Even my daughter took almost like 3 weeks to accept the bottle when I rejoined work after my maternity leave. But I continue to breastfeed, express and leave it. There's a method of storing expressed breast milk. So you can continue. Just because you go to work doesn't mean it's an end to breastfeeding.
Yeah, definitely. So another question is, my baby has a left leg defect, but it didn't show in the anomaly scan. So they found out only after she gave birth. So what may be the cause of that?
Leg anomalies are very difficult to pick up on the ultrasound, even if the radiologist is an expert, because the legs are folded. All they can do is count the number of bones and maybe measure the length of the legs. But I don't know how major the defect is, but it's quite common for it to be missed out on an anomaly scan. But there are certain deformities, like we call it CTEV. They can be picked out by anomaly scan, but they're not so major that the child will have long-term defects because of it. So I think you should meet an orthopedician, but don't just sit and think about, oh, what if it was picked up in the anomaly scan. What's done is done, right? And it's quite common. It's unfortunate it happened to you, but now that the baby is born with it, like, let's go forward and try to deal with the problem and get him as better as possible.
Yeah. Okay, so another question is, the government hospital asked to purchase the additional vaccine and bring it to the hospital, and then only they said they will give the vaccine. So I guess this is related to vaccines. We were talking about not to buy it in pharmacies, but a hospital is asking them to buy it and then bring it.
Okay, so I'm not too clear on which vaccine this is. So they might have asked you to buy something which is not part of the national program, which is normal. I mean, we do that too. But when you bring it from the place that you've purchased, make sure that you carry an ice pack. If not, I mean, you don't need the whole box like you do for blood products, but even a small ice pack is fine. So put the vaccine in that and bring it so that you maintain the cold chain. Even in, like, we have a pharmacy in Kathmandu Medical College where some of the vaccines are put. But we know that that pharmacy belongs to us. The cold chain is maintained. It's not like we're sending them to an external pharmacy where we are not too confident on how the vaccine has been dealt with in terms of cold chain maintenance. It's a little vague, your question, so I don't know whether I've addressed it properly.
Yeah, that was the question we received. So yeah, if you have any follow-up questions, you can also reach Dr. Smriti directly, right? She's available at KMC, her timings, and yeah, you can also send it to Yoma as follow-up if you have any follow-up questions. And okay, Dr. Smriti, thank you so much. We've come towards the end of our Linsta Live. I think we had quite a fairly good number of viewers. We had like 35 people viewing, and it was alternating, it was oscillating a lot, but a lot of people are very grateful for your feedback, and they've written in the comments that they are very happy with your detailed explanation, and that's why they've also asked for where you're available, when they can meet you. So yeah, thanks to all our viewers for viewing, for asking the questions, for having this discussion going. And yeah, this is one of Yoma's first Insta Live sessions, and we'll be having more in the coming days. We'll be having a weekly session we have lactation consultants, gynecologists, endocrinologists talking about gestational diabetes, pediatricians, so lots of other relevant experts who will be coming in on a weekly basis. So please keep, follow Yoma, look out on our page, and hope more of you join in.